The American College of Cardiology and Merck are celebrating 33 years of partnership in supporting future cardiovascular leaders. Since 1981, the ACC Merck Fellowship Program has provided a unique opportunity for carefully selected awardees to launch a career in cardiovascular research. 4 fellows in training are chosen each year and provided $70,000 in support for research in adult cardiology. The awardees are chosen by the ACC's Research Fellowship Awards Committee, and that is chaired by Dr. Joe Hill. Now, the 2014 ACC Merck Fellows, let me introduce them to you. Dr. Jennifer Louie, Columbia University Medical Center. Dr. Venkarta Narla, University of California, San Francisco. Dr. Viviane Tarchetti, Brigham and Women's Hospital. And Dr. Young Kim, Stanford University. As you can imagine, these FITs really enjoy research.
Yes, no, I love doing research. So one of the reasons I went into cardiology is that I felt like there were so many different ways to help patients. There's so much evidence and so many different ways to improve quality of care for patients. And I just think there's so many opportunities to think about how to better deliver care. And that's really exciting to see a patient in a clinic and then to take that interaction, to take that information and use it to help other patients in the community.
Yeah, so I very much enjoy doing research. It's very intellectually stimulating to me, and especially when you find a project that's really fascinating and exciting, you want to be able to produce novel results and be able to contribute to the pre-existing knowledge. So I find it very intellectually stimulating and exciting.
Yes, I do like research. I think as a clinician, research really opens up the entire opportunity for thinking about patient care in ways that are fundamental and allow for creativity and thinking about innovations for what's going to come next. So, my background's actually in basic science, and I was an immunologist before I became a cardiologist. And having that background informs everything I think about in cardiology. And surprisingly, there are a lot of intersections between cardiology and immunology and inflammation. And that's really the area that I'm super excited to work in and will continue to be able to do work in thanks to the Merck ACCF Fellowship.
The ACC Merck Fellows are expected to work on a project full-time for 1 year. And as you can imagine, they have a wide variety of interests.
Yeah, so I'm going to be working on a study that looks at the clinical outcomes of patients with congestive heart failure, especially racial and ethnic minorities, and looking at how a change in insurance plan policy actually affects clinical outcomes. And so I think that's an interesting project because more and more we're talking about, how insurance enrollment, how insurance type actually affects clinical outcomes. And so specifically, I'm going to be looking at how patient cost sharing, which means what percentage of care a patient is responsible for paying for actually influences how they seek care, how often they seek care, what type of care they seek, and how it might affect their medication adherence, how often they're hospitalized, and even mortality.
Yeah, so I'm looking at microRNAs in myocardial infarction and cardiovascular risk. So microRNAs is this novel field that's exploding over the past several years in many fields: cardiovascular disease, cancer, neurologic diseases, etc. And there's been some research, not much, on microRNAs in cardiovascular disease. And in particular, we're going to look at it in HIV-infected patients. And we want to see if they could be potential biomarkers and ultimately maybe even therapeutic targets to prevent cardiovascular disease.
So I'm working on many things, but in particular, we have made great strides in cardiology over the last 50 or so years in the treatment and management of heart disease, particularly as it relates to our ability to open up critical blockages in the coronary arteries through invasive interventions, for example. But it turns out we are increasingly more aware that even patients without very significant blockages in their coronary arteries are at risk for adverse cardiovascular events. My work utilizes a novel and non-invasive imaging technique that allows quantification of the absolute coronary blood flow in the heart to exactly look at these questions of mechanism that define patients who not only have obstructive coronary artery disease but also diffuse atherosclerosis, microvascular dysfunction that may put them at risk for bad events, particularly in patient groups that are of heterogeneous risk, like diabetics, like women, like older patients.